Good morning, guys. Thanks, Tony. Pharmacists across the country, are raising alarm about the overprescription of drugs that may help treat the coronavirus. Recent data shows chloroquine orders have spiked 3,000% in March, and hydroxychloroquine orders rose 260%. The FDA has not approved these drugs for treatment of the virus, but doctors are allowed to prescribe it. Our Dr. Jon LaPook, who joins us from his New York apartment. John, what do you know about these drugs?
Hi, Anthony. Well, hydroxychloroquine is used to treat autoimmune conditions like rheumatoid arthritis and lupus, but it's too soon to say whether it really works against COVID-19. That hasn't stopped some people from prescribing it. One pharmacist said it's being widely prescribed, and that's leaving some people who need it to control their autoimmune diseases unable to get it.
The one consistent medication I've been on since I was 15 daily is hydroxychloroquine.
44-year-old Marissa Tancherone has been taking the drug hydroxychloroquine since she was first diagnosed. Her lupus has been severe, requiring several hospitalizations, and the drug is a cornerstone of her treatment.
So for you, it's not a matter of having it in your medicine cabinet just in case. You need it. It's a matter of your health.
Yes, it is a necessity.
Chloroquine is an anti-malaria drug, and its less toxic derivative, hydroxychloroquine, often treats autoimmune diseases. It's sold under the brand name Plaquenil. The CDC is recommending patients who rely on prescribed medication try to get an extra supply, but Tancherone's doctor tried.
She called it into my local pharmacy. She also called it into the mail order pharmacy. Neither of those places can fill it for me because it's so back ordered. Thankfully, I still have a month's supply left in my cabinet. But of course, I don't know how long this is going to last.
I think it's going to be very exciting. I think it could be a game changer.
President Trump has touted the drug as a possible coronavirus treatment, but medical experts are only now testing it in trials. Still, pharmacists across the country say it's flying off the shelves.
We're seeing prescribers calling into pharmacies and trying to obtain mass quantities of hydroxychloroquine or Plaquenil.
Garth Reynolds is the executive director of the Illinois Pharmacists Association. He said a lot of these prescriptions are being called in for family members or friends of doctors.
I understand why some prescribers decided to do this, but this was an unethical and selfish action.
It's not just in Illinois. Pharmacists around the country have shared similar stories. In Florida, a pharmacist told ProPublica one doctor tried to get 200 tablets of the drug.
If I were one of these doctors who was unnecessarily prescribing hydroxychloroquine, what would you say to me?
I completely understand why you're taking this action. You're wanting to protect your family or yourself, but you and I both took oaths to protect patients.
Tancherone, who co-created the show Marvel's Agents of S.H.I.E.L.D. and is a Lupus Foundation of America ambassador, knows she's not alone.
All of us are in the same boat, so we just don't know how long this is going to last.
CVS Pharmacy said it's setting quantity limits on the amount of drug people can get, but that's not going to apply to people like Marissa who need it for their autoimmune disease. Meanwhile, the drug still has to go through FDA approval. Those trials began Tuesday in New York.
John, do you have any patients who've tried to get these drugs?
Anthony, I have. They've asked, and then I've explained to them, look, you don't want it sitting on your shelves not being used when people who actually need it can't use it. And I have to say that I've been very happy to see their response. They get it right away. Nobody's fought back. And one woman even emailed me and said, she apologized. She said, I'm so embarrassed that I even asked. Thank you so much for pointing out that this isn't a time for people to be hoarding. You got to think about everybody, not just ourselves.
You're exactly right, John. I think most people understand that. When will we know if the drugs are working?
You know, there are these clinical trials, Gail, and that means actually doing it with a group of people who don't get it and a group of people who do get it. And it can take a while before we actually know the results. And for now, this is just anecdotal. You've heard about that word. It means we don't really know if it works. Some people think that they've had a patient get better on it, but that doesn't mean that it really works. They could have just been getting better on their own.
Yeah, it's experimental for coronavirus, but so necessary for people with other conditions, which is important to remember. John, thank you very much.